Welcome to yet another, hopefully interesting, entertaining, and most importantly, enlightening edition. We like to call it edition. Back in the days, they taught us that if it was radio or television, it was electronic. If it was electronic media, then it was an episode. If it was print, it was an edition. These days, well, edition just fits all. So welcome to this edition or episode, if you like, if you're a stickler of COVID-19 heroes. My name is Femi Obong-Daniels. It's a delight to be here. This week, my brother and friend, co-anchor, Dr. Wiebe Boer, will be looking at strengthening health service delivery through innovative private-public partnerships, the kind of conversations we would like to have, the kind of conversations you would like to hear. And we've got a hero as guest today. Let me start by saying welcome to you, Wiebe. How are you doing?
I'm good. Thanks, Femi. How's everything going?
Well, we are in one piece. And I know typically we would start with outcomes in football and all of that, right? Yeah. What has caught your attention lately, other than Barcelona?
I don't think we need to say anything else. That's enough. Let me just... I had a really good laugh. No, the bad thing, though, is that Ronald Koeman is now their coach. Mm-hmm. You remember, I'm Nigerian, but also Dutch.
Yeah.
And so now we're wondering where we're going to go in the Netherlands. But, that'll sort itself out. So.
Well, isn't the whole tiki-taka thing originally Dutch, by the way?
Exactly. It was Dutch total football invented for the 1974 World Cup, where we, lost the first World Cup final about a month after I was born.
And one day you and I will talk about the differences between tiki-taka and catenaccio, but it's not today. Today, we have a hero who has no idea what we're even talking about, but I could be wrong.
She probably does. I think she does. All right, so let me bring her in. So today our guest is Dr. Alero Ann Roberts. She has plenty titles. Like, we could go the whole show just talking about her titles. So I'll just use one for now, and the rest will come through the show. But she's, among many other things, she's the vice president of the Wellbeing Foundation Africa. So good morning, Dr. Roberts, and thank you very much for being on the show.
Good morning, Wiebe and Femi. Thank you very much for having me. And you're right, I do know a lot more about football than I ought to know.
Oh, I spoke too fast.
So what's your club?
Dare I say it on public? I've got too many sons and a husband. I dare not. Sorry.
Okay. All right. Maybe we can pull it out at some point. Okay. So, but listen, let's kick it off. We have a lot to talk about. So, Dr. Roberts, maybe you can kick us off by talking about your personal journey. You started as a medical officer, became a hospital administrator. You've had a very successful medical career. Tell us more about this background and what has been the motivation for you.
Very, very briefly. Well, I'm the daughter of a doctor. Of course, my father, Professor J.T. Kofi Duncan, was the first radiotherapist in West Africa. So I guess medicine was pretty much a no-brainer. Mm-hmm. And having graduated medicine, I started the usual stuff. You do the house job, then you go into a job and you are basically just a medical officer. But he had a private clinic, a private hospital. And of course, I started work there. And as time went on, I got really cross with the quality of physicians that seemed to apply for the jobs and the basic things they didn't seem to know. So I went back into medical education, got a master's in public health, stayed on as a lecturer in the College of Medicine, and went on and got a fellowship in public health because, my final year of medicine, we were trained by the late great Professor Oliko Ransom Kuti, and that's sort of caught my attention. So from then to now, right now, I'm still a lecturer at the College of Medicine, University of Lagos, but of course, in my public health role, I, interact a lot with civil society organizations, the Wellbeing Foundation being a critical one, because they look at my key interest area, the outcomes for women and children.
All right.
Okay.
Dr. Roberts, let's start with two areas that I am, I'm sure you are significantly involved in. One is rural primary care service delivery. The other is the development of strategies to improve universal access to quality care. There's nothing about this that you don't know. Your background says it all. How much progress do you think Nigeria has made in this regard?
Well, in view of the fact that the National Broadcasting Commission has just sort of fined you guys, I think I'd rather be diplomatic than honest. So let's just go with diplomacy. As every teacher would tell you, there's room for improvement. Rural primary healthcare service delivery and universal access to quality care are left and right hand of the same person, so you can't do the one without the other. And what we are finding is that because attention hasn't been paid to the former, it's not sexy, it's not glorious, there are no white ribbons to cut in villages and outposts. It hasn't gotten the attention that is needed. And therefore, you have a lot of inequitable access to quality care. And it's unfortunate that we are here, Nigeria, almost age 60, still talking about this, when countries with far fewer resources than we have and who have had, far more challenges than we have faced, seem to have sorted it all out. I mean, it isn't rocket science.
Okay, so Femi, was that diplomatic enough?
Well, it's just enough. It just. I was going to throw in another question, but it's going to go over the lines of diplomacy, perhaps. So let's stay here.
I'm sure we'll cross the line later in the discussion. So, but let's now get back to just sort of the simple things. So you're presently the vice president at the Wellbeing Foundation Africa. So tell us about your role there, and then sort of broadly what the foundation does.
Well, the vice president of the Wellbeing Foundation is a fancy title for somebody who sort of oversees and makes sure everything possible that can be done to advance the vision and mission of the foundation is being done. So it's our primary goal, our primary vision and mission in very simple terms is trying to improve the outcomes, the health outcomes for mothers and children. So when you think about it, I mean, for the woman to get pregnant safely, so we've doubled in areas where women are not being able to get pregnant safely. For a woman to be safe during the pregnancy, have access to adequate care during the pregnancy and get all the adequate medications that she needs and checks and balances and immunization. For her to deliver safely so that at the end of it, as we say, we hear the voice of the mother and the voice of the baby. For the baby to live past the first 24 hours, past the first week, up to the first birthday, second birthday, get the immunization, making sure that the child has access to adequate nutrition, starting with breastfeeding. Can you believe that in 2020, breastfeeding is still an issue? Adequate access to breastfeeding, adequate access to support and counseling for that. And then when you take it broader, the woman is the hub of the family. So this is a woman who, this may not be her first baby. So there are other toddlers running around. Are they safe? Do they live in a safe environment? Is she able to get them water to drink, water to clean, water to prepare safe meals? Is the compound clean? Is it safe? Or are the children running around, milling around next to, unsafe wells or a bit of an exaggeration perhaps, but, unexploded devices, which has happened in some parts of Nigeria as a sequelae to the Civil War, Then going forward, do the children grow well? Do they get access to decent education? Are they given enough information to keep themselves safe from sexual exploitation, gender-based violence, domestic violence? So the Mama Care 360, which is one of our key programs, encompasses all of this. The environmental issues, the gender issues, the violence issues, the water, sanitation and hygiene issues, universal access to healthcare in its totality. This is what the foundation is about, using the mother and the child as the entry points.
All right, it's a good thing that you talk about the mother and the child, because all of this is, there are issues around community and health service delivery, especially in these times of COVID-19. The most vulnerable and exposed, no doubt, women, children, women, even worse, pregnant women, and of course, children. So you said this is all it is about for you, for the foundation. Is there any, or are there any interventions for a solution during this time?
To be honest, there are loads of interventions. Some we've been able to do very successfully. Some we are still looking for the wherewithal to do, but these are all very important. So one of the first things that happened when the pandemic hit us was, and of course, we went into a lockdown. Women were unable to move. So pregnant women couldn't get to clinics for their antenatal care. There were issues of whether they were going to deliver safely. And, this was not just a physical block in terms of the fact that women couldn't get transport to the centers, but this was also a psychological block that the women were now afraid, not just for themselves, but for their children. What if they went out and got infected? What was going to happen then? But because we've had a mama care program running, and our midwives, who are our foot soldiers, are out there in the community doing interpersonal communication with the health workers, they've also established a rapport with pregnant women, because the pregnant women could now see them as a source of information and education for everything that the pregnant woman was concerned with, and they would get that information and education tailored to the particular woman's personal need, as it were. So it was very one-on-one, very personalized information that the woman would get. So one thing happened was that our midwives developed WhatsApp groups with the pregnant women that they were interacting with, and that became a source, a platform in which they could not only deliver education to the mothers, they could then take queries from the mothers. And because the mothers were now confident that there was no question too silly to answer, quote and unquote. Every single question that the mother asked, no matter what language she asked in, no matter how basic, she would get a reply. And she would get a reply on the platform, which then educated other mothers. But of course, she'd get a call from the midwife. And we, the doctors in the foundation, were also part of this program. So we were able to also monitor and make sure that the advice and the education that was going out was scientific, effective, and accurate. And it was amazing, because it then gave us in the foundation deeper insight into the things that concern pregnant women in different areas. So it has helped us to further strengthen our programming to deal with issues that most generally may have been overlooked. It was really quite interesting. So in all of that, we found that we were able to then signpost the mothers to the health facilities where we work and get them in at a time where there won't be an overwhelming crowd, where the doctors and the nurses and the other midwives in the facility were ready to receive this particular woman, because they knew ab initio what her issues were and whether she needed to come in for an examination or for some intervention. So it was actually an amazing opportunity, and one we definitely are leveraging on to take up to scale. Sorry, I didn't warn you I spoke too much.
Well, you are a lecturer, so we give you that. So, but listen, so just to carry on, you're an advocate for strengthening health systems in collaboration with civil society. So how successful has this been in the fight against COVID in Nigeria? And are there sort of specific examples that you can share?
It has been amazing. It's been absolutely amazing, because at the end of the day, when you think about it, public health is everybody's concern. And I must say, my foray into this started with Ebola. In 2014, when the dreaded words Ebola, Lagos entered the same sentence, and everybody was like, oh my word, what's going to happen now? And through the most amazing arrangement of the stars aligning, we were able to pull together a coalition of very deeply concerned people who in their individual rights were quite highly placed in the private organizations they represented, to get the immediate help that the then Commissioner of Health, Dr. Jide Idris, and the then Executive Governor of Lagos State, Babaraji Fashola, needed. And of course, this help came in kind, came immediately at the time that it was needed. And it helped us to understand the powerful collaboration that we could have with private sector, with CSOs, once you eliminated the issue of mistrust. Because once the goods were delivered or the services were delivered and they were critical to the job in hand, then the donor, as it were, whether a private sector, whether a multinational corporation or a CSO or whatever, the donor was certain that the goods or services he or she provided were not in any way violated or misappropriated or misaligned or misdeployed, in any way got missing. That was essential. So it was something we knew we were going to grow, and it was something that another of my hats that I wear, the Association of Public Health Physicians, was immediately able to key into and become the critical interlocutors between civil service organizations, community, multinational corporations, government, to further the objectives of public health. So we were hugely successful in Ebola, but don't forget the huge success we witnessed with Ebola was also on the shoulders of the successes we had been having with polio. So through the polio campaign, Nigeria had been able to develop platforms and strategies which were all immediately deployed to the Ebola response, and proved so absolutely fantastic. And it helped us to identify key organizations in the private sector, civil society organizations, and key people in public sector who would always be there for the country. And that's very important, because these are who I call the unsung heroes, like medical officers of health. No, nobody knows, very few people actually know that in every local government in Lagos, I can speak for, is a medical officer of health who is a public health physician. And her major objective is ensuring that the health status of his or her community is improved. They have no, I mean, if they wanted to make money, they could have gone into private practice. They didn't. Okay. They opted to stay in the community, and these are a vital part of the fight that Nigeria or any country has against poor health indices. So we were able to identify them. Of course, we've been able to identify midwives. Again, a very unsung group of heroes. Amazing women who are ready to work at the community to make sure the next generation of Nigerian is born safely with every opportunity to achieve their full potential. Sorry, am I talking too much?
Yeah, okay. You can stop now. By the way, if you are just joining us, this is COVID-19 Heroes with me, Femi Obong-Daniels and Wiebe Boer. And we are talking about strengthening health service delivery through innovative private-public partnerships. And we're having this chat with Dr. Alero Ann Roberts. She is, amongst a million other things, the Vice President, Wellbeing Foundation Africa. Dr. Roberts, apart from health service delivery, and apart from what you just explained about strengthening health systems in collaboration with civil society organizations, you've also preached about the importance of trust within local communities. So I'm going to hit you with a barrage of 4 quick-fire questions. One, is it fair to say that a significant population of Nigerians in rural communities don't believe COVID-19 is real? Now, if your answer to that is yes, has this attitude changed much in recent times? Now, can you also share how effective medical awareness programs have been in these rural areas? And the final one is, what will it take for rural communities to take the threat of COVID-19 or whatever COVID it is more seriously?
Okay, first of all, Femi, I'm going to make a slight correction in the sense that rural communities probably don't have as much of a problem with COVID as the urban communities have, simply because they are already physically distant, both within and between. So can I bring this back to our metropolitan areas, metropolis, Lagos, crowded urban slums? We've all heard how Alimosho local government and Etiosa local government are the local governments that have the highest proportions of positive cases and whatnot. So coming back to that, the issue of trust, yeah, you're right. It is fair. It is definitely something we're seeing, that most and generally Nigerians, a lot of Nigerians don't really believe COVID-19 is real, and among those that do, they just don't take it seriously. After all, this is just the junior brother of malaria. This is just a flu, it's just a cold. As to whether we haven't yet done any sort of peer-reviewed study to document this, but just anecdotal chats, the wider majority of people, and watching the behavior because it's what you know that determines your attitude, and that attitude tends to predict your behavior. So it's what we know from their behavior that this hasn't really. Then amongst those who do believe that, oh yes, COVID-19 is real, but you know what? It's only a disease of the rich and famous. It's because, you know, I don't travel, I don't get into airplanes, so I'm not at risk, sort of thing. Now, whether this attitude has changed much, let's also bring in another side of this. You know, amongst these communities, there are far more urgent health needs and health concerns. That COVID-19 is like, oh, now because it's COVID-19 and it's affecting the rich and famous, now you want to come and engage us on it. All the time we were fighting issues related to poverty, related to inequity, related to overcrowding. You didn't bother to come and engage us. You didn't really care whether our clinics worked or our hospitals worked until you, the rich and famous, couldn't travel abroad for your healthcare. Now you suddenly want to. So there's that attitude. We're beginning to see that come out as well, particularly when the emergency COVID response was transiting from an emergency response to a more community-based approach. So what can we do? What would it take for rural communities to take the threat more seriously? We, the so-called elite, we, the medical elite, we, the political elite, have to first listen to them and address their needs. There's a very common concept that we teach in public health. You go into a community to engage a community, you listen to that community, you determine what their felt needs are. You, of course, as a professional, you can determine what the observed needs are. But if you do not align the felt needs with the observed needs, I promise you, you're not making any traction in that community whatsoever. And the way you are shaking your head, Femi, you totally agree, because when you put it at a personal level, you know, I'm busy telling you I'm hungry. I'm really, really hungry. I mean, I'm hungry. I can see you with a full buffet table full of delicious things to eat, and then you're asking me about my sleeping habits? Come on. Do you understand?
Clearly.
We all relate to that. And so when we go into a community to engage a community, we must be able to align their felt needs with the observed needs that we come in with. And most and generally, you will find that a lot of communities are deeply, deeply angry. Succession of administrations that have not addressed those felt needs. I'm very happy to say that most and generally, Lagos can be excused from that, because we've had successive administrations since the turn of the century that have worked to address these felt needs, and I must give them kudos for that. We're not all the way there yet. Room for improvement.
All right, so I know that Femi is going to kick us off soon, so let's jump in with another question. So, what's your assessment of the private sector engagement in all of this, and donations and so on to public health? Has it been sufficient? Is there a lot of support, and is there still more to be done?
There has been fantastic support.
Okay.
We need more support. There's a whole lot more to be done. But what we have definitely been able to identify are the opportunities for support, and what we're working desperately to achieve are those trust channels, so that private sector feel confident that their donations, and we shouldn't call them donations, we should actually call them philanthropic contributions, because it has to be a you win, I win situation. So everybody tunes into that FM station, what's in it for me, FM. So we have to be able to develop those trust channels that will be able to make their donations all the more cogent.
All right. Look, you play a key role at the Association of Public Health Physicians of Nigeria. As a last question, and we've run totally out of time, one, I would like you to just briefly touch on what your association is currently whether your association is currently championing any national intervention policy, and how you think COVID-19 will permanently change the face of public health in Nigeria. What we can learn from the pandemic to, like Wiebe always says, to build back better. What do we do?
Yes, very quickly, we are running out of time. Let me see if I can do this in 2.5 minutes.
You don't have 2.5 minutes. Go on.
The association this is why I'm here. I mean, this is one of the key things that the association has been able to do, make that connection between mass communication and the people, to be able to translate a lot of the national interventions and policies into what we call common man's language. It's very important, because common man's language is not just dumbing down the ideas into simple English, it's actually making it relevant to different situations. So what I would tell you, Femi and Wiebe, would be different from what I would tell a community that's, say, suffering in a situation where there's no water or sanitation hygiene. And it has permanently changed the face of public health in Nigeria. Now, the importance of public health is out there, it's being seen, and it's not just the domain of the public health physicians. People are beginning to see the need to have public health journalists, public health lawyers, public health engineers. Very, very important. Public health, civil societies, public health community engagement, everything relates down to public health, because if it affects your neighbor, it does affect you. And we have to learn, I mean, build back better is ideal, but without the political commitment, can talk this thing and we'll still be back again here next year, God forbid, saying it again. But we do need to build back better from the grassroots up. So it's about primary healthcare service delivery that will translate into not just focusing on the white ribbon cutting ceremonies of opening up massive, better not say it. Let's be polite.
Dr. Alero Ann Roberts, amazing woman. For me, personally, superhero. She's Vice President, Wellbeing Foundation Africa. Thank you for gracing us with your presence and your time, and keep up the good work. I could never thank you enough, so I will leave that to Wiebe to take us home.
So thank you very much, Dr. Roberts. Thank you for being very diplomatic, not getting Femi in trouble. But we can't go off air without knowing your club. You have to tell us your club. Now you're at the end. What's your club?
Or the one you have sympathy for?
The one you have sympathy for.
What's my what?
Your club. Your
football club. The one you have sympathy for.
I still have to live in this house. Wiebe, don't even try me. Okay.
It's a democracy, isn't it?
I had so much respect for you. Oh well. Okay, we won't hold it against you. All right, well, thank you so much, Dr. Roberts. It's been a fantastic show. We packed a lot into 30 minutes, but I think the public learned a lot, and we really appreciate you for all that you're doing.
Thank you very much for having me.
We'll be back next week. Have a wonderful week, the rest of it. Bye-bye.
Set your time on 99.3 Nigeria Info, the correct time.